Can the medications I'm taking affect my baby? What are the effects of alcohol on my unborn child? Can the chemicals in my workplace affect my fertility or pregnancy? These are some of the questions that can be answered by a program called Mother to Baby. And today on Lunchtime Live with the Center, Sharon Levine, research coordinator of Mother to Baby, is here to talk about this service. Sharon is also a licensed genetic counselor and clinical instructor in the Division of Human Genetics at UConn Health. Hi, Sharon. Welcome.
Hi.
Sharon, what is Mother
to Baby?
Oh, you're welcome. Can you talk about what Mother to Baby is and what service you provide?
Mother to Baby is a free service. That free part is very important. We answer questions about for individuals who are planning a pregnancy, pregnant or breastfeeding, that have questions about exposures. So that can range anything from medications that they need to take to infectious disease, to chemicals that they work with, perhaps job-related questions, to drugs and alcohol. So it really pretty much runs the gamut of anything that you could imagine. And we provide the data, the most current reproductive data on whatever those agents are, and so that that person can make the best reproductive decisions for themselves about whether this is something that they feel comfortable being exposed to, or something that maybe if it's a medication, maybe they want to talk to their providers about, is there an alternative that I might try that would have either more data or more information suggesting it's not harmful to be used while pregnant.
Okay. Are typical questions related to, do people usually come to you with regards to medications mostly?
Medications is the predominant issue. Of course, we ask everybody about cigarettes, alcohol, whether or not they're diabetic, those sorts of things, so that we can get a better sense for what other exposures there might be. But predominantly medications, and it can include over-the-counters as well as prescription.
Now, you work with women who are thinking about having a baby, pregnant, and breastfeeding. Are they different? Are your suggestions different for each category?
Yes. Yeah. So for each individual that reaches out to us, they're going to get an individualized risk assessment for them. So we take into consideration the whole picture, why they're using the medications. Would there be ramifications if they stopped using their medications? Would not using the meds be more harmful than using them, as well as what stage in the whole reproductive process they're at. Are there any fertility issues that could be of concern with what they're exposed to? And then pregnancy issues, we go by where in the pregnancy they're at. Are there concerns early on but not later on, or vice versa? And then when they're breastfeeding, we determine can we determine whether or not that things that they're exposed to, could they be in breast milk and then be exposing the infant that way? Okay. So everybody's going to get their own individual assessment. Even if I'm talking to 3 people about the same thing, they're going to get what applies to them specifically.
Is this a worldwide organization or a nationwide organization, or is this just local to Connecticut?
Mother to Baby Connecticut is the Connecticut affiliate for an organization called the Organization of Teratology Information Specialists, and we are nationwide, have several services. We also have Canadian counterparts. And the bigger picture is there are international services, and they have different names. They don't fall necessarily under our U.S. umbrella or North American umbrella, but I can reach out and have a question about perhaps a medication that we don't use much in the States, and my counterparts in Brazil or in Israel or in Japan are going to answer and say, hey, I've had some experience, here's what I know about that. So it is anywhere you end up in the globe, you would have access.
Oh, great. When is a good time? So we're talking, because we're fertility, when is a good time in the fertility process for a patient of ours or someone who's going through fertility treatments to call you?
I think the best time is when you're going to be able to absorb that information without, I know at the center there's a lot going on and there's a lot of things that they might need to do. And that might be something that they could cross off their list quite early on and, not really worry about it from that point forward. So very early on in the process might be the best time to get a feel for, what am I using? Are those things I'm going to be able to stay on? Am I going to have to make substitutions? Are they any of the things that I'm currently exposed to going to interfere with the process? So I think as early on as we possibly can is the best time.
So even right around the beginning of right around when they're starting the process.
Absolutely.
To talk
Because
about
let's say there's an exposure they're uncomfortable with, and they can go back to your docs and say, hey, this is the blood pressure medicine I'm on, and the information is concerning to me. What do you think we should do? And let the physician and the patient, discuss that information and decide, is that something that's okay to stay on, or should we try something now? And not every medicine works for everyone. So when you're not pregnant or not in the midst of the process is the best time to figure out whether the alternative is actually going to be useful.
What can someone expect when they call you? So they would call you first.
Well, this is COVID time. So yes, we're predominantly phones, but we have switched to email for the time being. We will get back to phones and in person, hopefully this year sometime. But what happens is you send an email to the service and you ask your question, whatever that happens to be. I will respond. I may need more details. I may need to know why you're using something. What's the dose that you're on? I may ask for the labels of any of the over-the-counter products so I can look at the ingredients specifically. And then I'll put together the information that you're looking for. So if you're not pregnant, I will make sure that includes any fertility information that's available. If you're already pregnant, we're going to talk mostly about, what trimester are you in? Is this something you're going to need to stay on? So we cover whatever details are necessary. And then, of course, you get an email with all that data in it. And then the provider, so at the center, your doctor, whichever healthcare provider is treating you, will also get a copy of that information.
Okay. And you said your services are free.
The services are free. Yeah, we're funded predominantly through the state. The health center, Yukon Health, covers a big chunk of our operating budget, but we do get funds through our national organization, which are funds that come from HRSA, which is a federal funds, and the state health department gives us some funding as well. So we're your tax dollars at work.
Right. How can someone contact you? So
the email's easy. Yeah, the email's the easiest way, and it's MotherToBaby, all one word, at UCHC for Yukon Health Center.
Okay.
.edu, and it's a private email. It comes to me, and one other coworker has access to it. We don't share those with anybody or anything. And then, like I said, we'll have a dialogue back and forth. If it's something really complicated or patient has a lot of questions, then we might set up a phone call. Okay. And because again, most of the time we used to do these things by phone. So if it's super complicated or the patient's really struggling to get through some of the specifics, then the patient and I will make a predetermined time to talk by phone.
Can you give an example of what super complicated would look like?
Super complicated. So for example, not necessarily one of your patients, but one of our high-risk patients here in the clinic may have 30 medications she's using.
Okay.
And they may be prescriptions. They may be a combination of prescription over the counter, supplements. And so the high-risk specialist, would like to know that information to know, is there anything we need to carve out? Is there anything we need to switch up? And the patient, 30 medicines is a lot. I mean, that's the typical is significantly less than that, maybe 1 or 2 or 4 or 5. But yeah, we can get a really long list of things to go over.
And when you have that list of medications of over-the-counters, are you also in contact with the doctor that might have prescribed that?
If the patient would like us to share our information with their provider, we can do that.
Okay.
We're a confidential service, so the patient gives us permission to do that. With the center, usually what your docs are saying is, call this number and they'll share with me what they share with you so that we're all on the same page. I forgot where I was going with this. The people who not every doctor is going to get a copy of the information. We used to do that years ago, but we just don't have the manpower to make sure that everybody gets a letter or gets documentation. Now with email, which is great, is the patients are all getting documentation.
Okay.
Instead of just a phone call, they're actually, having something they can refer back to.
Okay. Megan Casey says, thanks to Sharon, along with my team, I feel more prepared for my upcoming transfer. Excellent. I highly recommend.
Hi.
Allison Carter says, can you mention the email again? And
Okay.
we'll also put it in the comments.
Yeah. And we have a Facebook page too, but the email is the best way to reach me. Don't try to reach me on Facebook. Email is MotherToBaby, MotherToBaby, all one word, at UCHC for Yukon Health Center .edu.
Excellent. Is there anything that you think that, based on the people that you've seen, that you'd like to share so that they can be better informed that we haven't covered?
Well, I think when you start the process of thinking about building a family, you're thinking about, what do I need to change in terms of my lifestyle so that I'm healthy as I can be. So those are the common things you might think of. Curb your drinking, smoking. If you're using recreational drugs, those are kind of things you want to carve out. And then think about your underlying health issues. Do you get seasonal allergies? Is that something you want to, make sure you have in control? Your asthma, is your asthma in good control? Your weight, your diabetes, all those things you want to try to be as well as you can before you start the process. And I'm sure that's a conversation your docs have with all your patients. And then when they get to the point where they're, really actively trying, of course, prenatal vitamins that include folic acid, make sure all their vaccines are current so they don't have to worry about any infectious diseases. Those are kind of the basics that you would run through when you're thinking about starting a family.
Excellent. Okay. Well, Sharon, thank you for being here today.
Thanks for having me.
You're welcome. And we will be back next week for another Lunchtime Live. In the meantime, be sure to check out our website at yukonfertility.com for additional information, as well as a calendar of events to support your fertility journey. Take care.
Thanks, everybody.